Hello and welcome to State Matters. I'm your host, Matt Muratore. My very special guest today has been a geriatric nurse practitioner for close to 30 years. From 2009 to 2011, she was the director of the Bureau of Healthcare Safety and Quality at the Massachusetts Department of Public Health. And from 2011 to 2013, she served as the director of the Division of Nursing Homes in the Center for Medicare and Medicaid Services, CMS, in Baltimore, Maryland. Currently, she is the Secretary of Executive Office of Elder Affairs for the Commonwealth of Massachusetts. Please join me in welcoming Dr. Alice Bonner. Well, thank you, Dr. Bonner, for coming, or Alice, because we go back a long way.
We do.
Let's talk a little bit about your background. We always like to let our viewers know who our guests are. Can you talk a little bit about your background? As I said earlier, you just got a fascinating background.
Well, I started out in a nursing home because I kind of ran out of money in college. I needed a job. And back in the late 70s, you didn't need to be certified to be a nursing assistant. So I got this great job, and I just fell in love with older people who were living there and with nurses who, in the old days, you know, nursing homes really were run by the nurses, and I thought that was...
And they wore the caps.
And they wore the caps.
Yeah, I remember that too. I started out as a dishwasher in a nursing home in 1977.
There you go.
Yeah,
so we were doing the same thing.
Yeah.
So that's kind of how I got interested in long-term care and working with older people and their families and the communities. And so from there I went to nursing school and became a nurse practitioner because I really wanted that comprehensive ability to manage and really co-manage with the person what they want, what, you know, help them to achieve their goals as they get older. And you know, we're all in this together. This is not about younger people over here and older people over here. We are all in this together as a community because everyone's aging, and I think that's kind of the reframing that we're seeing. You hear the governor talking about it, you hear the lieutenant governor, Secretary Mary Lou Sudders talking about, this is about all of us. Doesn't matter what your age is. We should all care about this, and we can all work together.
Yeah. You know, I want to talk about your geriatric nurse practitioner, because you've been doing that for almost 30 years, even before people were becoming geriatric nurse practitioners. What made you decide to get that and go into that, and maybe not a doctor or whatever? Well,
nurse practitioners have that ability to provide primary care, and we can prescribe, and we work very closely in teams. So what I like about what I do as a nurse practitioner is, you know, working with my physician colleagues, my nursing colleagues, the nursing assistants at the bedside, because that's how I started. And so you get this appreciation, I think, having been a nursing assistant, a nurse practitioner, that, you know, this is really about a team, and the person, whether it's a patient or a resident, or sometimes we call them consumers if they're living in their own home, that's the person who should be driving the process and telling us what matters most to them. And if you start with what matters to the person, then if you're a nurse practitioner or a physician or a geriatrician, you know, you can really get at a care plan that will work for that person and help them achieve the goals that they have for themselves.
Now, when we first met years ago, it was at Mass Senior Care Association, who is the trade association for all the nursing homes and now assisted livings in Mass. What did you do there, and why were you there?
So I was the executive director of their foundation, so I didn't really have anything to do with the association, not too much, but really at the foundation we worked to build the scholarship program for nursing assistants, which has been one of the greatest, I think, achievements of that organization.
Yes.
So people who are nursing assistants, very often they're not jobs that pay a lot. They don't get a lot of benefits, and it's hard for them to go back and get more education and training and things that they're interested in. So this scholarship foundation really allows those nursing assistants to pursue their education in whatever their interests are, and to support them. They have hard lives. A lot of them come from other countries, we know. They might work 2 or 3 different jobs. They're raising children, and they're taking care of the most vulnerable, frail elders in our system. So I've always really cared a lot about that workforce, and still we have Mass Senior Care Association, we have Mass ALA, we have Leading Age, and many other organizations that, the Home Care Alliance, work across all of the different settings with that workforce to help support them, help promote what they do. So that was one of the biggest things that we did at the foundation. And then we also went after research grants so that we could do research in long-term care, whether it be nursing home, rest home, assisted living. And I think we're now approaching aging as wherever you are on the continuum. So maybe I live in my own home right now, and then I have to go to the hospital for something. Maybe then I go to a nursing home or skilled rehab for a bit, and then I want to go back to my home. And so people just move across all these settings, and what we want to do is train a workforce to be able to support people wherever they are.
And that foundation has done tremendous work over the years. Every year there are dozens and dozens of nursing home employees, as you say, mostly CNAs, that then become nurses or therapists. And it's so needed more and more. And they don't give just $100, $200. They give $2,000 every time to each person. So it's still going stronger than ever. And we thank you for your work on that in the early days. And it's great, successful programs. So we need to continue with more of those programs. Now, you also worked at the division of you were the director of the division of nursing homes in Baltimore for the Center for Medicare and Medicaid Services. That must have been interesting. Tell us about that.
So that was a very exciting time because the Affordable Care Act had just gone through, and so we had all these sections that we had to implement. So, for example, quality assurance and performance improvement was one of them, and that's how nursing homes and now other settings, assisted living, hospitals, can look at how their system works and improve the systems to lead to better quality care and better outcomes for patients and residents. So we developed a lot of trainings, and we were all over the country working with different states, again, largely with older adults, and trying to figure out how do we create the safest, the highest quality nursing homes, assisted living, hospital systems to support patients and families. So we worked on that, and across the country, we were able to look at best practices in different states and say, oh, in Minnesota, here's something really interesting they've done in nursing homes that worked well. Or in Wisconsin, they do a lot of work on dementia care, people with Alzheimer's and related dementias. And they've spread the program in Wisconsin from nursing homes to community-based care now. And they have dementia-friendly communities. So the fun part about being at CMS is you get all the different best practices from around the country, and you can come back and say, here's some good policy that we've learned about from lots of other places, and let's put it together and let everybody know this is a best practice, this is a good policy.
Is that how the 5-star rating came to be?
The 5-star rating was there before I was there. So in the early days,
it's more prevalent now, though, than the last few years in nursing homes.
Nursing homes?
Yeah, that's how consumers really look for.
Oh,
yeah,
more,
with the
it's
star
more
rate,
used by consumers,
absolutely,
yes.
Yeah.
So that system was put in place, I think, largely because consumers wanted to know, how can I tell the difference between this nursing home or that nursing home? We hear that a lot in Massachusetts, whether it's assisted living or affordable housing or picking a healthcare provider. People do want information. So one of the things that we do is we try to, give people the resources they need to get the information that will help them. And we have programs like Mass Options. So if if somebody said, I don't know how to choose a nursing home for my dad, or I don't know how to find a geriatric provider in my community, if you call Mass Options, they'll probably connect you with the Aging Service Access Point, which is what we call our ASAPs. Those are the elder services organizations in each community.
Old Colony Elder Services is right here.
Old Colony, right?
Yep.
Or they might connect you with the Council on Aging if it's a question about insurance, because they have Shine counselors and things like that. But Mass Options is both a website where you can type in and chat with somebody and ask a question, or you can call our call center and you get a live person. And they'll direct you to the local resources that is what you need to get your questions answered.
And you also spent a short period of time at the Bureau of Health Care Safety and Quality for DPH.
I did.
Before you now take this role. So how is that role different from your current role?
So DPH is the agency in our state that oversees the quality in nursing homes and rest homes, hospitals, dialysis centers, community health centers, those kinds of settings. In my current role, we oversee assisted living, but that's really the only regulatory oversight that we have. The rest of our programs and services, like our home care program, again, is contracted through these aging service access points, so it's more of a distributed network. We do oversee quality in that network through our designation process. So once every few years we go out and we look at the records and we talk to the staff, and we are very involved in the quality work that the ASAPs do with us. But I'm much more involved now in home and community-based programs. So our state home care program that serves about 60,000 or so low-income elders every year. We work very closely with our Medicaid agency, which is Mass Health. So again, lower-income seniors, people who need a little assistance. We also have DTA, the Division of Transitional Assistance. So working more with community, people who are living in the community versus some of the acute healthcare system work that I did when I was at the Bureau. But we work very closely with our colleagues at the Department of Public Health. Certainly, we're getting into flu season, so we're going to encourage people to get their flu vaccines. And we work with them on things like the Alzheimer's and related dementias. We just did a big report last year. The Department of Public Health was the lead agency on how we care for people who have dementia when they go into the hospital. So if someone has a hip fracture or gets pneumonia and has to be in the hospital, but their underlying diagnosis is Alzheimer's disease, it can be devastating for that person. It can be very confusing. They might try to get up at night and fall out of bed because it's an unfamiliar environment. They might refuse to have their labs, their lab tests drawn because they're afraid and they don't understand what's happening and being asked of them. So this entire report that we did was to help hospitals think even more about all the people that they're seeing now with dementia. We have about 130,000 people with dementia in the Commonwealth, and so they have higher rates of hospitalization, and our hospitals already do a lot around this, but this was some resources and a guide to help them do even more to build on what they've got going on.
That's great, that's great. And one of the other things I discovered too is that you were associate professor at the School of Nursing. Was it Northeastern?
Yeah, Northeastern.
Northeastern, that was my alma mater.
Oh,
yeah,
there you go.
Yeah,
at Bouvet.
That's great. My God, you got a great background.
Well,
great background.
we need nurses.
Absolutely. I just heard today that there were, on average every year, about 10,000 nurses in Massachusetts are retiring. And there's only 5,000 on average that are coming into the program. So there is a great need for nurses now, and the average age, I think, is close to 50 years old for the average nurse.
Yeah, there's a need for nurses and a need for nursing faculty. So
yes,
we
that's
don't.
the issue.
Right. We have slots and waiting lists because we don't have enough faculty to teach. So.
Well, let's talk about the mission of your office, the Executive Office of Elder Affairs, and how it supports older adults and those with disabilities.
So our mission, which came from our group itself actually, is that we promote the independence, empowerment, and well-being of older adults, people with disabilities, and their caregivers. And the vision that we have is that older adults and people with disabilities will have access to the resources they need to live well and to thrive. We like to say that our agency and the work we do really throughout the Commonwealth is about how we grow up and grow old together. And for us, whether we have people in our agency who are in their 20s and 30s, and we have people all the way up into their 70s who are employed by our agency. And we don't make any distinction because we're all aging from the time we're born. So this isn't about us saying, we help those old people over there. That would be wrong.
It's a different way of thinking it.
It is a completely different way. It's
that.
saying we are all aging together. Let's figure this out. How can we help one another? What do you want when you're 80? Where do you want to be living? What do you want to be doing every day? What's going to make you happy? What's going to keep you engaged? And so the work that we do in our agency is really about a number of very specific programs and services. So, our Shine counselors, that helps people with insurance information, or Prescription Advantage, which is our drug insurance program and helping low-income seniors pay for some of their medications, our home care program, our options counselors that help people figure out where they could live and what their options might be for living in the community, and many more. We also have protective services. So those are, that's to help people who might be the victims of elder abuse or financial exploitation, which unfortunately is a growing problem.
Yeah.
But those are programs and services that we run every day. In addition, our team works very closely with Secretary Mary Lou Sutters of EOHHS and with the governor and the lieutenant governor on what we're doing around becoming an age-friendly state. And so that really means reframing this thinking about getting older and saying, how can we come together across all of the agencies, all of the secretariats, and all walks of community life and say, what do we want our cities, our towns, our Commonwealth to look like if it were livable and inclusive for people really of all ages, but in ways that would support each of us as we get older, so that we could stay in our home if we wanted, or have an affordable assisted living in our community, and we could stay engaged and involved in the things that we really care about and like to continue doing. My mother is 88, and she lives in Northampton, so that's out in Western Mass, and she still sings in a singing group, and she takes tap dancing lessons on Thursdays at the Senior Center. And her dementia is pretty advanced. She's a lot of trouble with her language, but she's been a dancer her whole life, and she can still do that. And so for her, that's what matters. That's the important thing every week for her to get to on Thursdays at 1:30. And so it's that kind of thinking. What are the assets that somebody like my mom bring to her community? She volunteers. So she brings food from the Big Y supermarket with her companion. She couldn't do this alone. They bring food to the Survival Center, which is, a shelter for people who are experiencing homelessness. But for her, that makes her feel, valued, and it's a meaningful thing because she's always done those kinds of activities. And for thousands and thousands of seniors across the state, they are our asset in cities and towns. You know all about our senior nutrition program, where we have congregate meals and also a lot of home-delivered meals. We serve something like 9 million meals a year.
Oh, wow.
And the drivers of the vans or the drivers of their own cars who deliver those home-delivered meals are very often seniors. Most of them are retired, or they're people who donate some of their time to their community. When we have ride-sharing programs where someone needs to go to the doctor and they need a ride to get there, very often it's a senior who's volunteering. So, as we get older and we have a little bit more time, maybe because our kids are grown, maybe we don't have to work full time, although a lot of people do now, those volunteer hours are like gold. And older people are tremendous assets in our schools. Right here in Plymouth, you have such a great setup.
Isn't that wonderful? Yeah.
You have your Community Center for Active Living, which is what you call your senior center,
for
which
Active
I
Living.
love.
Yeah, that's great. Yeah.
You have that right on the campus of the high school.
Yeah.
So, the people from the Center for Active Living can walk around the track, and when the kids have a history assignment, they can come over and actually hear from someone who actually was in Vietnam or, did live through the Great Depression and can talk about it. And, those oral histories and capturing,
wonderful.
It's just so valuable.
Yeah,
so.
yeah. You talk about the volunteers, and I think this is why the Center for Active Living in Plymouth, I think it's going to be celebrated its 5th anniversary in December. And it's really exploded over the last 3 years with so many people coming. But it's exactly what you said. It's seniors that are coming to help other seniors. And you'll see people in their 80s there that don't see themselves as elderly.
Absolutely.
And they're actually out there helping, delivering Meals on Wheels, rides, or whatever else they can do. But that's why it's exploded, because so many people are coming there to help.
Right.
And as we begin to age more, This community, I think, is 18% of our population is over the age of 65. So as you see that more, you're going to see more and more people, I think, helping and volunteering. Every year we have a annual volunteer luncheon that they have for all the volunteers, and every year there's this big mock check that says how much the volunteers have donated by not getting paid for the town, and it's close to $800,000 every year from all that work that they do. So we couldn't do it without all these volunteers.
Absolutely.
Yeah. So if an older resident or their family members need any sort of assistance or advice about services to help them continue to live in the community, where can they call? Is it that the Mass Options that you were talking about, or is there? Can you talk about that a little bit more?
Sure. So if you're not sure where to call, Mass Options is the best number to use, because there are trained operators at UMass Medical School at their call center, and they will ask you a series of questions.
Is that Monday through Friday?
It is Monday through Friday, but the hours are. Let me look it up. I can't remember the hours because we changed it recently. But it actually, we used to have weekend hours, and there may still be some weekend hours as well. But you can also chat. You can chat and go on the website anytime. But the call center has very good hours, and they will ask you a series of questions to find out which local resources would be the best. Very often, they will get you to the Aging Service Access Point, which is what we call our ASAPs. And that's the Elder Services organization in every single community. So regardless
they're usually the first point then of contact.
They're very often the first point of contact, especially if someone needs some support to stay in their home, because it might be the home care program or health related. But the other organization that very often you'll get connected with is the Council on Aging. So that's where the senior center is often located. And those organizations have, again, information, referrals. They can connect you with different local organizations. They know when the support groups meet. Very often there's, LGBT support groups, caregiver support groups, sometimes men's groups, just a whole variety of different types of meetings that are happening and opportunities. I'm looking for a job. I need help with employment. Well, we have our CSEP program. If you're a low-income individual, you might qualify for that. So the Council on Aging, the Aging Service Access Points, those are great, first points of entry into our system, and the Mass Options folks can get you there.
We touched upon this earlier, but the Baker-Polito administration did the age-friendly movement. And I remember the governor, when he was talking about doing this, I think he joked that he was turning 60, so it really needed to. But why do you think that is so important for us to focus on that here in Massachusetts?
Well, so I think you actually captured it when you were talking about the volunteers, because what age-friendly helps us understand is that older people are an asset. And they are running a lot of our communities. They're also, look at the boards of selectmen, look at the, a lot of local government is also run by experienced people who've been in professional roles and want to give back to their community. So age-friendly is a movement across the country, but Massachusetts was only the second state in the nation to actually be designated by AARP as officially working toward our age-friendly plan. And that means that every city and town eventually is working in some way on these 8 pillars, which we think about with age-friendly. So it's things like housing, transportation, civic engagement and socialization, the information and communication we've been talking about, knowing the local resources, preventing isolation and loneliness, and creating open spaces, parks and recreation, and local businesses where anyone's welcome. So if you have Alzheimer's or dementia, if you have a physical challenge, if you have a child with autism who, again, has behavioral aspects to their condition, that anywhere you go in a city or town, in an age-friendly city, there are shopkeepers who have had their consciousness, raised around these issues. So whether you go to a barber shop or a hairdresser or a gas station or a restaurant, people understand what it means to be older. Somebody might need a little bit more time to read the menu. Maybe the font needs to be a little bigger so you can see it. Maybe the lighting needs to be a little better. So, physical environment is part of it, but it's really this notion of valuing our older citizens and valuing for ourselves as we get older.
Right.
The contributions that people make and recognizing the contributions people make in their communities.
The opposite end of that, though, there is a lot of folks out there, and I think this is where the Meals on Wheels folks come in as well. A lot of times it's not just to deliver meals, but in a lot of cases it's the only contact a person will have because folks are isolated.
Right.
And what can communities do about folks who are just isolated and lonely?
So it's such a big problem, not only in the United States, but across the world. In Great Britain, they actually have now a new ministry, and it's the Ministry of Loneliness. They actually have a official position there. What we did here was kind of interesting, was we looked at this as an opportunity for entrepreneurs and innovators. And so we partnered with GE and the MIT Age Lab, and Benchmark Senior Living also came in, and together we created the In Good Company Challenge, which again, GE was largely spearheading this challenge, and it asked people to submit ideas, and I think we have over 60 already. It might be closing this week, and it's a competition, and we asked people, if you were going to solve the problem of isolation or the problem of loneliness in older adults, how would you do it? What would you propose? And we asked them to think about transportation or housing or different parts of people's communities. Because, if you just take transportation for a moment, you might really want to participate and go to your Center for Active Living. But if you live out in Western Mass in those little hill towns, you don't have a bus that comes at the end of your driveway. And your driveway is probably a mile long. So, so what's the solution for that? So we have a lot of entrepreneurs and innovators thinking about these issues. In terms of what we can do now, what we already have in place, we have through the ASAPs, different programs, activities, ways people can get involved. We have those also through our municipalities that are becoming age-friendly. And for people who are caregivers, and very often we have over 800,000 caregivers in the Commonwealth, and they get very isolated because they can't leave the person they're caring for. We have our Family Caregiver Support Program, and so that's a federal program, and we run those out of our Aging Service Access Points as well. So trying to connect people, get them to support groups, get them to other resources and other people going through what they are.
We have 10 seconds left. Real quickly, you and I actually participated in the annual Falls Prevention Month in September. Give some folks some real quick tips on that. In 10 seconds.
10 seconds. Good footwear, have your medications checked, get physical exercise, and have good lighting and a safe environment in your home.
Dr. Bonner, thank you so much. Always a pleasure to see you. And thank you for what you do around the Commonwealth for elders in our communities. We appreciate that.
Thanks very much.
We hope you enjoyed today's show. I want to again thank Dr. Alice Bonner, and of course, Ben and Dave and all the volunteers here at PAC TV for another great show and for all they do. Thanks again for watching. We'll see you next time on State Matters.